the central wrist pain. So on the radial side, you will have a decurvent disease, you will have scaphoid, and you can have first CMC joint, and we talked about that limbar Comstock deformity where you place the thumb and even the index starts flexing because of the adhesions of the two tendons. So from the radial side, we'll go to the central pain. On center, what are the bones lying? There is a dorsal rim of the radius, listed tubercle, scapholunate joint, second and third carpometacarpal joint, lunate. So out of these, the red ones are the more important ones, which will be seen more often. Again, the word is point tenderness. With exactly the moment the patient says I have pain, it doesn't lead us anywhere. It leads us to rheumatology, vague. But if the patient said I have pain here, he's telling you, okay, these are the things. He's feeling the pain on the hair, he's telling you something. And the moment he said I have pain in the center, he's telling you, okay, skin box disease. And very early stage, the X-ray may look normal, MRI would be positive, but at a slightly later stage, you will see the lunate looks dense. Now to see this, the most important thing, ask for the X-ray of the carpus. If you see a big X-ray of the whole hand from the tip to the elbow, probably that tiny dot of lunate will be missed, and therefore see a magnified view, and then only you can pick it up. And don't see that X-ray which used to be that dip mercury thing. It has to be a digital X-ray, and then only you will see a dense lunate in the later stages. It may be further, it may be collapsed. Then this is another thing, and I think I'll cover it here, carpal bossing. It's premature degeneration of the CMC joint, and it is hard bony bump on the dorsum at the base of the second metacarpal. And if you see an X-ray which is a tangential view means you bend it and see a tangential view, you will see on the X-ray, and what you see a bony bump at the base of the second and third carpometacarpal joint, and this is tender. And this may or may not be with a ganglion. Often it would be with a ganglion. So you have a ganglion and premature degeneration of the CMC joint, and surgically you expose it, you take out the ganglion and the bone. Now what is lying here? The bone is lying deep to the tendon of extensor carpa radialis longus and brevis, and therefore retract these tendons, save these tendons, and remove this bone. And sure enough, you can remove the ganglion and the extra bone that has formed. Dorsal wrist syndrome is another entity where point tenderness is there. If you take an X-ray, you will see a localized synovitis at the dorsal aspect of the capitate and the lunate. This is a localized synovitis. This is dorsal wrist syndrome. Treatment is surgical. Excise the local synovium, and this synovium is localized to capitate and lunate. Sometimes the ganglion is very tiny. You just have to palpate very deep inside, and over the junction of the scapholunate, you will see a small ganglion. Initially, you may just give a cock-up splint, but if the problem is persisting, you have to take him to the operating room. So when you're talking of the central wrist pain, the commonest thing is the avascular necrosis or cane box. We'll talk about it separately. Carpal bossing is an important second differential diagnosis, ganglion dorsal wrist syndrome.